Now, what if the person can't tolerate the ACE inhibitor because they developed a dry cough and it's making them crazy? They've invented a new class of drugs that are angiotensin II antagonists, or also known as angiotensin receptor blockers, known as ARBs. If I can block the effect of angiotensin II on the receptors, on the adrenal glands, on the vascular tree, and stimulating the sympathetic nervous system, on plasminogen activator inhibitor. If I can block the effects of angiotensin II, maybe I can't stop its production, but I can block its effects at the receptor site. Now I have what's known as an ARB. And so it's going to lower blood pressure the same way that an ACE inhibitor will. It has the same applications in high blood pressure, especially in diabetics who delay diabetic nephropathy, and in congestive heart failure. Patients who are unresponsive to ACE inhibitors will often be put onto an ARB. The adverse side effects are similar to the ACE inhibitor, but you have a lower incidence of the cough. So often they'll move to an ARB. The ARBs often end in artin, like losartan is an example. So when you see losartan, anything ending with artin, you pretty much know you're dealing with an angiotensin receptor blocker. What if you could make a drug that actually inhibited the action of renin on angiotensinogen in the first place? If I don't convert angiotensinogen into angiotensin, then what I have is a renin inhibitor. That's what they're called. So the renin inhibitors, they work, and you'll see the names of them up here, but the side effects are dreadful. Very few people are put onto renin inhibitor. The odd time you'll see a patient on a renin inhibitor, but usually that's not the drug of choice, because it often causes angioedema, so you get swelling of the dermis and the subcutaneous tissue, hyperkalemia, which can upset potassium balance and lead to cardiac arrhythmias, or hypotension, diarrhea, rash. You start to get elevated uric acid levels that can cause kidney stones. These are not really popular antihypertensive drugs. All right, so let's talk then about what it is that you can do for the hypertensive patient. So what really should jump off the page now is, if the person has high blood pressure and there are secondary issues with it, they have angina, they have an arrhythmia, they have a heart block, they have congestive heart failure, you're like, okay, some of these drugs have to be utilized. But if the person just has uncomplicated high blood pressure, there's no other cardiovascular issues going on, they just simply have high blood pressure, then are there things in the world of lifestyle medicine that have been proven to bring the blood pressure down to decrease the person's reliance on these drugs? They may not even need them, because all these drugs come with some potential complications. So in the research that we have, and I provided this in the notes service, a full review article, these are the things that have been proven to work. In patients who are overweight who have high blood pressure, if that group of patients were to lose just some of the weight, then in 2/3 of cases their blood pressure goes down to normal just by losing the extra body fat. For two reasons. When you're overweight, there's more insulin resistance. You secrete more insulin after a meal. Insulin increases the resorption of sodium and chloride in the bloodstream, so you have a higher blood volume when your insulin levels are higher. So if I lose some weight and I have better insulin function, more insulin receptivity, I don't secrete as much insulin after a meal. I don't resorb as much sodium chloride from the tubules back into the bloodstream. My blood volume drops. My blood pressure goes down. And when I have a lot of abdominal obesity, the pressure on all these vessels is creating tremendous peripheral resistance. Diastolic pressure goes up. The heart has to work even harder to pump the blood. Just from physical pressure on the vessels, you're getting high blood pressure. So a lot of people who are overweight have high blood pressure. If they just lost 10 to 15 pounds, they don't have to lose all the weight. The blood pressure goes to normal in 2/3 of the patients. So how does the person lose weight? Well, that's a whole other discussion. And in my book, I cover the exact program that I've used over the years. But if you can just get the patient, honestly, just to do a power walk for 30 minutes a day, at least 5 days a week. That means walking at a pace as if they're late for a very important meeting. They just walk at that pace 30 to 40 minutes a day, 5 days a week. And they cut out a lot of the high animal fat products and things that are just super sweet. Try to find some solution substitutions for them that still make their life interesting and fun. You'll see that their blood pressure will go to normal, and they often won't need the drugs if they're willing to do it. But that's proven as a very important step in bringing blood pressure down. Alcohol raises blood pressure. Once you get beyond one alcoholic drink a day, it increases the force of contraction of the myocardial cells. Less alcohol, blood pressure goes down. Sodium restriction, cutting back on discretionary salt, of course, is going to make a difference. Less sodium load in the first place. For a lot of people, that makes sense. And as I explained to you earlier, when you give the patient more calcium, and with calcium you also would give magnesium, when you give them a dose in the range of 1,500 milligrams of calcium and roughly 600 to 1,000, that should say milligrams, 0.6 to 1 gram, so that would be 600 milligrams to 1,000 milligrams of magnesium with that, then the increased calcium in the kidney tubule is going to encourage the resorption back into the bloodstream of calcium, and less sodium will be reabsorbed from the tubule back into the bloodstream, and so more sodium and water will stay in the kidney tubule. You'll decrease the blood volume just by giving more calcium and magnesium. So the same amount of calcium and magnesium you need to reduce the risk of osteoporosis is the same amount that helps to bring blood pressure down as well in people who are particularly sodium sensitive hypertensive patients. And then giving them omega-3 fats. Remember that omega-3 fats from fish and flaxseed and from fish oil, flaxseed oil, remember that the platelets convert that into prostaglandin series 3. Prostaglandin series 3 in platelets becomes with a certain type of prostacyclin, and that makes the platelets less sticky, which is good. But in the endothelial cells, the endothelial cells create dilation effects. So you dilate the blood vessels, creating less peripheral resistance. The diastolic pressure goes down with more omega-3 fats. When the diastolic pressure is less, the heart doesn't have to pump as hard, so now the systolic pressure also goes down. So giving people omega-3 fats from fish oil, and flaxseed oil has been proven to bring their blood pressure down, not by drastic amounts. These things are all additive. They lose weight, less alcohol, more aerobic exercise, calcium and magnesium, some omega-3 fats. They're all additive and the blood pressure goes down. And the person's never really told about the clinical studies to show that this is real. The other way that you can add to this effect is by giving the patient a combination of CoQ10 and hawthorn. Those agents have been shown in many clinical trials at a dose of 120 to 180 milligrams of CoQ10 a day and hawthorn 150 to 225 to bring blood pressure down through a number of mechanisms, which is explained in your notes. But it's helping to create better bioenergetics in the heart, in the vascular smooth muscle. Just seems to be less irritable, better dilation, more nitric oxide is being produced to dilate the blood vessels. This has some natural effects, as we saw earlier. So one of the things that I did is I created Cardio Essentials, maybe you know about it, from Adiva, which has the CoQ10 and the hawthorn together. So I give my patients 4 to 6 capsules a day. That would give them the dosage that's been shown to lower blood pressure, just to simplify it for them, or they can take these things separately. On the essential fatty acid side, the supplement that I created that I like called Nature's Essentials has the flaxseed, the fish oil, and borage seed oil as well, because it factors into some other health processes. So I would take myself each day 3 capsules of that. That's what I do. Garlic supplementation also lowers blood pressure. I'll take your question in 1 second if you don't mind. Garlic supplementation has been can lower blood pressure. It can dilate blood vessels, make platelets less sticky, and have a number of effects. What I don't like about garlic is that it's been linked to bleeding disorders 2 ways: by having a very pronounced anticoagulant effect, and secondly, some of the elements of garlic, when it's taken as a supplement in concentrated dosages, can also irritate the GI tract and cause erosion. So just like an aspirin can cause erosion to the GI tract, it can slowly but surely lead to an increased risk of bleeding through the GI tract. And there are a number of human case reports of people using garlic supplements causing internal bleeding. I normally recommend that they don't do that. You can lower your blood pressure and lower your cholesterol and get anti-cancer effects with other nutrients without using garlic. So my advice to patients is not to be using garlic supplements because of these adverse bleeding events that have been shown to occur. Aerobic exercise has been shown to lower blood pressure, as we talked about. There's a number of effects that occur, including bringing adrenaline down below the baseline, so less renin's being released. You're not causing the heart to contract with as much force, slowing the heart rate. There's less peripheral resistance. Aerobic exercise is one of the best ways to manage hypertension in people that have essential hypertension. So it's a very important one that often gets neglected. And then, of course, as I said, biofeedback, visualization, guided imagery, yoga, any mind-body thing that will lower the stress level, lower the stress hormones, decrease the sympathetic discharge. With chiropractic and massage, anything that will bring that internal stress environment down for the patient very often brings their blood pressure down. So when you review it, losing some weight, a walking program, less alcohol, less sodium, calcium, magnesium, omega-3 fats, CoQ10 and hawthorn, aerobic exercise at the level that makes sense for them, and any type of mind-body stress reduction techniques. When patients put all those things together, in a very large percentage of cases, they can get their blood pressure down to normal, unless there's complicating factors. The World Health Organization says 75% of all people with high blood pressure, it's in the mild to moderate range, and lifestyle modification could actually bring their blood pressure down to normal. That 75% of people with essential hypertension could actually get it down to normal without medications. I think that's totally lost in our society today. The use of diet, exercise, supplementation can lower the patient's requirement or dosage of medication, reducing potential side effects. Even if they can't totally eliminate it, by lowering the dosage, often you decrease the risk of side effects. What I provide in your note service package, there's 2 articles that deal with the role of exercise in cardiovascular disease and also exercise as therapy for cardiovascular disease. I'd like you to read those 2 papers from the journal called Circulation, which is the major journal of the American Heart Association. 2 very good review journals talking about the effects of exercise on cardiovascular health. I'd like you to know the general details of that. And remember that in diabetic nephropathy, and we'll see this again, not only are you trying to use an ACE inhibitor, let's say, to stop the progression of kidney disease, but you also have to make sure you don't clog up their vessels with cholesterol, so cholesterol also becomes an issue there. It's not just about giving them an ACE inhibitor, and you lower cholesterol with diet, exercise, supplements, and possibly drugs, if necessary, as well as, I said exercise, so that's covered.